Good afternoon, everybody. Welcome to the Health and Social Services Subcommittee on Appropriations budget hearing today. It is February 12th, 1 p.m., and we have three budgets before us. We're going to go in the order that's on the agenda. So we'll do first DHS Administration, followed by MDH Public Health Administration, and then Department of Housing and Community Development. We have numerous witnesses signed up for the third one, many of them virtual. So please, if you're waiting your turn to testify or, you're here with us today, please just be patient with us as we go through that process. So we will begin with DHS Administration. And as always, we welcome our DLS budget analyst to the table. Welcome. Thank you. And you can begin when you're ready. Just make sure that the microphone's closer to you before you begin. Thank you.
Thank you, Madam Chair. Good afternoon. My name is Natalie Andrade, and I'm here with the Department of Legislative Services to present the fiscal 26 allowance for the Department of Human Services Administration. To begin, on page 1 of the analysis, you will see that the fiscal 26 budget increases by $29.2 million, or 9.3%, bringing the total to $344.7 million. As you can see, the fiscal 26 allowance increases across all fund types compared to the fiscal 25 working appropriation after accounting for proposed deficiencies. General funds rise by $13.7 million, special funds by $915,000, federal funds by $13 million, and reimbursable funds by $1.6 million. The increase is primarily driven by MD-thing-related expenses for operations and maintenance, as well as salary adjustment and associated fringe benefits. Jumping to page 6, the Managing for Results section begins with an analysis of children receiving appropriate care. Exhibit 1 on page 7 provides information related to the review of cases monitored by the Citizen Review Board of Children, showing improvement in educational services but ongoing challenges in access to physical and mental health services. In particular, after a decline to 62% in fiscal 22, the percentage of children receiving proper educational services increased to 79% in fiscal 23 and remained stable in fiscal 24. However, progress in physical and mental health services has been slow, increasing only from 42% in fiscal 2020 to 46% in fiscal 24. So DHS should comment on the steps being taken to address these challenges and improve access to physical and mental health services for children in foster care. On page 8, there is an update on the Human Services Careers Pilot Program that seeks to address workforce shortages by providing scholarships and stipends. The program has faced implementation delays in scholarship disbursements. The high school internship component is expected to begin in spring 2025 in Baltimore City, Baltimore County, and Prince George's County. The college scholarship component has received 111 applications, with 55 accepted, 27 denied, and 29 under review. So DHS should comment on the use of the fiscal 24 funds, including how much was spent for stipend or implementation activities. Additionally, DHS should clarify whether stipends are funded in fiscal 25 and fiscal 26. If stipends are not funded in these years, DHS should explain how it plans to support these efforts. On page 9, the fiscal 26 budget includes a proposed deficiency appropriation of $9.1 million for fiscal 25. The largest portion of this is $7.8 million that is allocated for the Constituent Services Call Center contract due to higher than expected costs. Other proposed deficiencies include $872,000 for legal service expenditures under the Maryland Legal Services Program and $500,000 in federal funds for the Maryland Indigenous Family Partnership Grant. Regarding the call center, DHS should discuss why the total funding for that contract, as supporting that contract in fiscal 26, exceeds the amount that the department indicates is needed by more than 20 million, and any plans to realign funding for the contract to consolidate costs in one location to provide more transparency for overall funding levels and costs. On page 11, Exhibit 2 shows a breakdown of the fiscal 26 budget. As you can see, the largest portion, 157.6 million or 46%, is allocated to MD Think, followed by 95.5 million or 28% for personal expenses, and 38.8 million or 11% for the Office of Technology for Human Services. On pages 12 and 13 shows the key changes in the budget. As you can see, the 29.2 million increase in the budget is largely attributed to an increase of 21.1 million of MD Think related expenses, including Amazon Web Services costs, system integration, and software licenses. Additionally, salary adjustments and associated fringe benefits account for an 8.2 million increase. On page 14, the personnel section details a reduction in turnover expectancy from 7.06% to 6.07%, with 63 vacant positions as of December 31st, 2024. While recruitment efforts have been made, 9 positions remain vacant for over a year. On page 15, the key observations section begins with an update on the MD Think project. MD Think is a cloud-based platform integrating Maryland's health and human services. While core applications such as the Child, Juvenile, and Adult Management System, the Enrollment and Eligibility System, and the Child Support Management System are operational, ongoing development is needed to enhance functionality and address compliance issues. The Department of Juvenile Services has discontinued CJAMS due to inadequate functionality, raising concerns about its future use. So DHS should comment on the implications for CJAMS following DJS decisions to discontinue its use. Certification for the Child Support Management System and Eligibility and Enrollment System remains pending despite years of operation. So DHS should comment on how certification is being conducted, why certification is still pending despite these systems being in use for several years, and provide an update on whether certification was received. Additionally, DHS should clarify whether CJAMS has already received certification. For fiscal 25 and 26, plan enhancements focus on streamlining benefits processing, improving case management, and upgrading data systems. DHS should comment on how much of the $157.6 million in the fiscal 26 allowance is for operations and maintenance, and how much is for enhancements to the system. In light of the state's fiscal outlook, DHS should describe why each plan enhancement is essential for fiscal 26. At the bottom of page 16, there is a discussion of the financial overview of the platform. MD Think expenditures reached $354.8 million from fiscal 23 through fiscal 25. In federal fiscal 24, $116.6 million was spent, with major allocations for Agile Scrum team development, shared platform, and the eligibility and enrollment system. However, discrepancies exist between DHS reported expenditures and state budget figures. For fiscal 24, DHS reported $116.6 million spent, while the state budget indicates $206.5 million. A similar gap appears in fiscal 26, where MD Think's total allocation is $158 million, yet specific IT projects account for only $65.8 million, leaving $92.2 million unaccounted for. So DHS should discuss the cause of the discrepancy in reported spending and the reason that the fiscal 26 allowance includes such a significantly higher level of funding than DHS reported that has been spent in recent years. At the end of page 18, starts a discussion of audit findings on MD Think. A March 2024 audit of the Department of Information Technology, DOIT, identified concerns over MD Think's cost increase and delays. The project's budget grew from $166.4 million in 2018 to $588.8 million in 2022, with completion delayed by 3 years. Regarding the findings related to MD Think, DOIT failed to justify these cost escalations and did not ensure timely resolutions for independent verification and validation issues. Initially planned for completion in May 2021, MD Think's delays stem from contract modification, expanded project scope, and technical challenges. Issues with the enrollment and eligibility testing, the child support management workflow redesign, and the CGEM's functionality gaps contributed to setbacks. So DHS should discuss the steps being taken to address functionality gaps in deployed components and the challenges encountered during implementation. Issue number 2 on page 20 discusses the new DHS Data Office, which was established to modernize data collection and reporting. While the office aims to improve decision-making with real-time data, DHS has reported challenges with data accuracy. So DHS should discuss the steps that it is taking to ensure data reporting throughout the department is accurate, the timetable for resolving data issues, the impact data integrity issues will have on the ability of the new office to produce reliable internal and public-facing data, and the cost of the new office. Issue number 3 on page 21 presents a recent fiscal compliance audit that identified a $100.2 million deficit in DHS non-budgeted clearing account. DHS management was unaware of this deficit until December 2024. So DHS should discuss any identified sources to address this deficit, or if general funds will be required, and the efforts that it has undertaken to monitor clearing accounts moving forward. To conclude, on page 23, the DLS recommendation is to adopt committee narrative requesting a report on the cost, implementation progress, and long-term sustainability of MD Think. And with that, I conclude my presentation. I'm happy to take any questions that you may have.
Thank you so much for the thorough analysis. You've identified some very important issues for us, and we really appreciate it. Do any members of the subcommittee have questions for our DLS analyst? Okay, seeing none, we will thank you, and we'll call up our DHS team. On my list here, I see the Principal Deputy Secretary, Carnitra White, and I believe you're bringing up some team members too? Yes? Okay, so I will allow you to introduce them and welcome, and you can go in any order you wish. Thank you, and you can start when you're ready.
Good afternoon, Chair Shetty and members of the subcommittee. I'm Carnitra White, and I serve as the Principal Deputy Secretary for the Department of Human Services. It's good to see you all again this afternoon. We'd like to thank Governor Moore, Lieutenant Governor Miller, and our colleagues at the Department of Budget and Management and the budget committees for their support. We're grateful to the Department of Legislative Services, Natalie Andrene, for her budget analysis. I always look over there. And joining me at the table today, I have our Deputy Secretary for Talent and Customer Service, Daniel Wade, and I have our MD Think Executive Director, Pat McLaughlin, as well as our Acting Chief Financial Officer, Jessica Smith. We also have members of our leadership team in the audience, including our Montgomery County Social Services Director, Oscar Manson. So the DHS budget, administration budget, includes 4 major budgetary units: the Office of the Secretary, Operations Office, Office of Technology and Human Services, and our local general administration. There are additional highlights around these areas in our testimony, but today we want to talk a little bit about MD Think. DHS serves nearly 1 million Marylanders annually. Both our customers and our 6,000 employees utilize the applications on MD Think daily. Over 555,000 Marylanders access our system weekly. These Marylanders are seeking information and application for essential benefits. Prior to MD Think, the 3 DHS administrations had individual legacy systems. Beginning in 2020, those legacy systems were migrated onto the MD Think platform. The eligibility and enrollment, the Child, Juvenile, Adult, and Management System, and the Child Support Management System are all supported on the MD Think platform. We use these systems every day to serve Marylanders and to issue essential benefits. These systems are how we operate. It's how we do business daily. Now I'll ask my colleague, Pat, to talk a little bit more about the platform.
Thank you very much, Carnitra, and good afternoon, everyone. Good afternoon, members of the subcommittee. When MD Think was originally envisioned and created, it was done so with a finite timeline in mind. It projected to be 4 to 5 years, mentioned earlier, of wrapping up in around 2021. What MD Think really has become is a dynamic, enterprise-wide digital services platform that's aligned with modern technology best practices. We highlight that as we move through the initial operational build-out of the systems. Then the routine operating costs will continue to move forward indefinitely. This is kind of similar to what you would get with any other type of technology platform. Think about Apple, think about Google. We're going to continue to evolve as a platform as needs arise, as changes are requested of us by our various partners, whether that be legislatively, whether that be through federal agency requirements. So it really is not a program in and of itself that will end at a given date. It continues to evolve over time. What's really interesting about MD Think and does directly impact the budget that we've talked about over the course of its timeline is how it supports multiple agencies. It initially did begin as a DHS-specific environment that would wind up modernizing the 3 major applications we talked about recently, or just before, of E&E, CJAMS, and CSMS. But it now includes the Department of Health, the Health Benefit Exchange, so Maryland Health Connection runs off of our platform, the Department of Public Safety and Correctional Services, the Department of Labor, and many others. So as we've seen the capabilities become available, more agencies have opted to become participants of the platform itself, thereby growing its overall ecosystem and also driving integration opportunities across the entirety of those particular agencies. What's key, though, is we've been able to shut down a lot of those legacy applications that previously were used. As mentioned before, eligibility enrollment, CJAMS, and CSMS are all replacing legacy applications that were operated on their own within DHS, and those are no longer live. But the reality is, when we think about MD Think, at its core, it's really a cloud-based platform as a service environment. What this does is it allows agencies across the state to build, test, host, operate, and integrate their mission-driven applications, their data, and new emerging technologies. It really becomes a driver for modernization across the entirety of the state. And our approach to MD Think is one that allows for ongoing operational changes to meet the needs of our users and customers across the various agencies. We're going to constantly, again, see these requests come in from our partners, be they in the state or federally, requiring new standards, new approaches, new changes that we're going to have to continue to implement in order to support the Marylanders that we serve. We have focused on building the potential of the platform to help the state agencies to deliver on their mission, specific health and human service benefits, and readying the platform to launch cross-agency collaboration on key initiatives. These initiatives are really driven to simplify the user experience for Marylanders, ensuring that they are served and that the state is administering its services more efficiently. And we've already seen a ton of success from this, not just in the overall life of MDThink, but a lot of the changes we've made over the course of the last 2 years. Particularly when we're talking about optimizing costs and enhancing the services that we're delivering to meet the evolving needs of both our customers and of the agencies that are on the platform. And I'll give you 2 quick examples. Last summer, the Department of Human Services implemented the Maryland Sunbucks program, enabling 594,000 students or children to have additional funding sources for food during the summer. We were able to spin that up over the course of a few months. That's a massive program that only took a few months to enable because of the changes in the modernization practices that are available on the MDThink platform. That would not have been possible without the platform being constructed the way that it is. A second example is we're currently introducing a new unified benefits program. This is an initiative that provides a much more simplified approach in providing access to benefits to Marylanders, particularly starting with access to Medicaid, to SNAP, to cash assistance, to home energy assistance, to the WIC program, as well as emergency assistance. And just in a short time period, we were able to spin up an entirely new program using human-centered design and mobile technology, so making it really easy to use, and launch this program in November after a few months of development. Since that time period, mid-November is when we officially launched this program. We've already had 50,000 plus Marylanders access the screener to identify through about a 4.5-minute questionnaire, about 12 questions, what benefits they're eligible for, and immediately begin that application process. So those are 2 advancements we've seen in the short term over the course of the last, call it 6 to 8 months, that are drivers as a result of being able to be used from the MDThink platform. And what's key with that is we talked about the cross-agency integration. That unified benefits program is one that integrates the services from the Department of Health, from the Department of Human Services, from the Health Benefit Exchange, and incorporates the Department of Information Technology into that work, working together as a team to deliver that as opposed to siloed or individual agency activities. The Sunbucks program also was dependent upon work with the State Department of Education. So again, we're looking at those opportunities for integration to drastically increase the way that we're able to deliver services and seeing the actual results on the ground. I mentioned human-centered design a moment ago, and we've shifted to this model that really drives customer experience at the front of all of our decision-making. And the way that we want to redesign a lot of our existing applications is to meet those human-centered design principles. This is going to result in a significant increase in customer satisfaction. And what this has resulted in is, as we've started to make these changes over the course of the last 2 years, we're starting to see these successes result in additional demand for faster changes. As we deliver on certain changes, there's more ask coming from either the federal government or from our agency partners in order to deliver upon those. We've long heard for a number of years that MDThink doesn't work. Well, part of the issue with MDThink is it's become a monolith. MDThink is one name for a number of very, very significant programs. Eligibility and enrollment, in and of itself, all alone, is a massive program that most agencies or most states operate as a single program. Juvenile and Adult Management System, same exact thing. Child Support and Management System, same exact thing. All of those individual applications are all considered MDThink, one place. But the reality is it's much more complicated and complex because it serves so many different Marylanders in so many different ways. And unfortunately, over time, by kind of calling it all MDThink, it's almost trivialized the importance of each of those particular programs. So what this has resulted in is really a focus on our part to transition that ownership back to the agencies. What we don't want to do is have a centralized program that owns all of the direction of these applications that the agencies themselves are responsible for not only administering, but really setting the tone and the roadmap for what needs to be done. And that's the model we've introduced now, is that each of these agencies are driving and leading the direction of these individual applications. The ongoing evolution that we're talking about right now is going to continue to include operational changes to meet users' needs. And as I mentioned a couple times, these modifications are driven from a number of different sources, be they legislative, be they operational from the actual agencies themselves, be them from the federal partners. We need to step up and meet those needs when they're called upon or when they're asked of us. We're also looking to continue to expand agency participation, again, referencing the Unified Benefits Program and the Maryland Sunbucks program that we mentioned just before. So as a result, what was originally projected as a 4 or 5 year finite program has really transformed into the state's sustainable long-term digital platform that we're able to expand utilization to multiple agencies, streamline processes by allowing those agencies to integrate services together, and ultimately end with the goal of simplifying the entire process of benefit access for Marylanders. So with that, I'll turn it back over to Carnitra.
Thank you, Pat. And with that, we'll go right to the issues that were in the analysis. So the first issue was around our ability to improve access to physical and mental health for the children who are in our care. So we have implemented several initiatives and partnerships to address enhanced physical and mental health services for youth who are in our care. This includes our monthly SSA health work group meetings, SSA audit compliance, quality improvement sessions, as well as our statewide advisory task force. We also monitor this as a whole through our headline indicators, whereas the Citizens Review Board does a small sample. I think they did about 600 cases. We have more details regarding this issue in our written testimony. Now I'll Deputy Secretary Dan Wade to respond to the next issue.
Good afternoon, Chair Shetty, members of the subcommittee. I'm going to respond on the comments around the Human Services Careers Pilot Program. That program had two main components, an internship component and a scholarship component. DHS made the decision to concentrate first on implementing the scholarship portion of the program. And as we moved towards that implementation, we realized that there needed to be some statutory adjustment, which was completed through amendment in the 2024 session. In partnership with the Maryland Higher Education Commission, our first scholarship awards went out in fall of 2024 with the award of 55 scholarships. We are conducting a second round of application review and intend to issue additional scholarships in the spring. We're excited to continue the work in FY25 and FY26, moving into the implementation of the internship program. More information about the efforts that we are making are included in a report which is linked to our written testimony. With that, I will turn it over to my colleague, Jessica Smith, our acting CFO, for the next question.
Good afternoon. In response to the DLS question regarding the call center contract, the increase in the Office of Home Energy Programs, the OHEP budget of $23 million is not for the call center contract. We inadvertently labeled the contract with the submission of our budget in the BAR's reporting management system. And we have notified DBM and we are working with them to make this adjustment in the system. This increase is a technical change to realign federal fund appropriation to spend the total available funding of the federal low-income home energy assistance program grants. And with that, I'll turn it over to Pat.
Thank you, Jesse. So I will respond to the questions around CGEMS, DJS, and a couple of follow-ups after that. So regarding the implications of for CGEMS on DJS's decision to discontinue its use, CGEMS is the state's system of record for Title IV-E eligibility, which supports children under the care of both DHS and DJS. So in order to minimize the need for any manual federal claiming data entry or processing, we're working with DJS to ensure that the system they choose integrates directly with CGEMS to ensure there is a consistent process for determining eligibility for Title IV federal funding for any of those individuals who are under DJS's care. And we'll continue to work in partnership with DJS to ensure that all of our youth are served. Related to the next question about certification of both the CSMS and E&E systems. Regarding the MD-Think certifications for eligibility and enrollment E&E, of those, 2 certifications are required. One of them is complete, the second is in process. So the certification for the U.S. Department of Agriculture's Food and Nutritional Service, that was completed in March of 2021. The Department of Health and Human Services CMS certification in June of 2024, we were actually contacted by CMS to indicate that we do need to certify. At that point, we had completed a previous no wrong door implementation, and once that was completed, then we were then eligible for certification. That review process for certification is currently underway actively with CMS. For CSMS, the certification process itself is still is in process right now. In the first phase, it's called pre-certification. It actually could not start until 6 months after the system went live. That first phase was initiated, and during the pre-certification process, a review of the entire system is performed to identify particular functions that may be deemed non-compliant. There's 1,100 different functions that can be identified as part of this process. Roughly 25 were found to be non-compliant and are currently being addressed. The second phase actually involves on-site visits from the Office of Child Support Services within the Administration for Children and Families. That is being coordinated and anticipated to be completed this year. Just for context around CJAMS, that system itself was found to be in substantial compliance with the Comprehensive Child Welfare Information System requirements in November of 2023 and deemed certified at that point. So for just in summary, E&E, the FNS certification is complete, CMS is underway, and for CSMS, phase 1 is completed, phase 2 is, phase 1 is close to completion, phase 2 will be starting soon. So I will then turn over to the budget and enhancements question. So regarding the MD-Think budget of $157.6 million in the fiscal 26 allowance, $125 million of that is actually specific to DHS work. The remaining $32 million is work that's reimbursed by our partner agencies. I mentioned before, as the platform has expanded rapidly, we have a lot of participation from external agencies. And $32 million of that is actually dedicated to those particular agencies as reimbursement. For the DHS work itself, we anticipate that about 47% of that is design, development, and implementation work, new enhancement, new changes, new modifications to the applications, while 53% of that is for maintenance and operations. I do want to call out that of that total amount of the 125, 60% of that is actually federally funded. And that's based on a reimbursable match rate. So each of the federal agencies that provide funding have different match rates associated with both their agency and the type of work being performed. So any adjustment that we have to budgets, obviously is not a one-to-one reduction or increase, because it all depends on the programs that would be impacted and the match rates associated with those. I do want to draw that the total budget here does go back to the conversation earlier about the monolith. So this is comprehensive of all of those independent systems on the platform, as well as the platform services. So this budget does consolidate those 3 major applications that I referenced and Carnitram referenced earlier. And they are typically maintained as individual applications in other states. So because we do have a single platform to handle all this and to integrate these systems, we are able to recognize significant cost savings through that shared platform and consolidated software licensing. I just want to reemphasize that said, the consolidation should not trivialize how large and impactful each of those individual applications on their own are. And we've made significant operational changes to meet the user needs over the course of this past fiscal year and this upcoming fiscal year. When the original applications were brought onto the platform, there was a lift and shift approach to legacy to new, and we've spent a lot of time over the course of the last 2 years really modernizing, changing, and enhancing the way that we operate with those applications. which has taken a lot of work, but it's getting them into a position where the comment I made before of everything doesn't work starts to be eliminated when we start to meet our customers where they need to be met, and we meet the federal and state requirements associated with those programs. The enhancements that we are implementing, they're to meet regulatory compliance requirements, both from the federal and the state. It's new feature functionality that is being requested both by the Department of Human Services administrations as well as the customers themselves. So we're doing a lot more work with the actual Marylanders receiving these services to understand what the roadblocks are, what the challenges are, and how do we fix those to make service delivery that much more effective. And we are increasing integration with partner programs for more efficient delivery of services and continued improvements to issues with current capabilities of the applications. And this is the way that we start to integrate when we think about a program as complicated as Medicaid. It touches a lot of different systems across a lot of different departments. How do we build a consistent approach to making sure that information is exchanged appropriately in a safe and secure manner that is timely and correct? And that's a lot of work that's gone into trying to continue to improve that process, and we still have work to do to get there. Over the course of FY26, we have a lot of work ahead of us, and we've provided a pretty significant list to you all as an appendix to the written testimony that provides the breakdown of all of the work activities we expect to perform over the course of the next year, and why they're so critical to complete in order to serve the Marylanders that we do. So next, I'll pivot to talk about the discrepancy between reported spending and the FY26 allowance. So regarding FY26 allowance and discrepancy, the analysis itself, which reflected the roughly $60 million for those applications, that is only the 3 applications associated. However, the 157.6 also includes the shared platform for the entirety of the state, which includes the new Unified Benefits Program because it is a multi-agency program, multi-agency and multi-beneficiary program, as well as the software, the AWS costs, all of the things that go into actually operating the statewide platform are part of that cost. Additionally, it did not include the external costs of $32 million that are based on costs that are to be reimbursed by partner agencies for the work that's performed on the platform. Let's see. So the next area that I'll cover is the functionality gaps in the deployed components. So regarding these functionality gaps that were identified in the analysis, all applications on the platform are currently in production and are used daily to support over 2 million Marylanders. So while DHS specifically has 1 million Marylanders in their portfolio or who are currently receiving services, we have many more through other agencies and programs across the state, and over 2 million are actively using the services on the platform. In 2023, we did shift the way we approach application development and kind of building out these different software applications within the program. We moved to something called a product development model. And basically that allows us to be more thorough in our concept development. What is it that we're doing? What discovery needs to go into identifying what our customers need? The design and prototyping and work and the testing of that. And we describe a little bit more in our written testimony as to the details around that, but that has allowed us to realize significant improvements in application capabilities and a drastic reduction in functionality gaps that were previously reported in some of the prior audits from 2017 through 22. Each application now has what's called a roadmap, which just outlines the planned functionality of enhancements and what the timelines associated with those are. That is a 2-year plan that gets introduced not only to the partner agencies, and they're the ones driving the direction of that, but to our federal partners, to partners everywhere, so that there's a clear indication of the work to be performed and the impacts associated with that. And as we're continuing to release changes to these applications, or if new gaps in functionality or issues arise, we're able to very quickly introduce the changes to those in the process based on this product development approach that we're taking. And I think something that's key when we think about functionality gaps, over this 2-year time period, we've actually seen a roughly 60% reduction in the number of bugs or defects that have been identified across the system. So that's a pretty drastic change in the overall maturity level of these applications that are now available. And the processes we put in place are actually seeing real changes on the ground right now. I will continue to pivot to additional reports on costs, and that's just the request for providing a report. We concur with that, and we'll provide that report. We do request a due date of December 1st, 2025, in order to ensure we have accurate reporting and also can align with our federal reporting, since that does complete on September 30th of each year. So, and with that, I will turn it back to Carnitra.
All right, I'm going to address the issue on our data office. We talked a little. Thank you. We addressed the issue on our data office. We talked a little bit about this in our overview hearing. When we began to identify challenges in the data that we were putting out in our reports, we took a really deep dive, a review of how we were creating those reports, which was in a manual and disjointed way. And so as we uncovered these challenges, we began to rebuild those approaches. And like our work on MD Think, we've focused on restoring data integrity and the validation of the data. And so this work has laid the foundation for the continued work that we will do in the future, including basic training on data standardization across all of our department. And we believe that our data integrity efforts in 2025 will ensure that our data can be made public via data dashboards. And so that's some of the work that our data office is going to be doing right now. And I want to make a note that our data office was implemented using existing administrative budget, and so we will make those official adjustments in our sub-program showing the data office during our submission of the 2027 budget request. And then to respond to our last two issues, I'll ask Jessica to do so.
In response to the $100.2 million non-budgeted clearing account, we anticipate reconciliation of this count to be fully complete by the FY 2025 closeout. And to do so, we will review the 2024 year-end non-budgeted clearing account and process any journal entries to eliminate the deficits. As stated in the fiscal year 2024 closeout review, the system reports depict a positive net balance that will offset the negative balance that we see. And the Comptroller's General Accounting Division confirmed the availability of these special funds from the FY24 closeout sitting in the non-allocated account. And the expenditures will be reported against these unallocated special funds balances. And as a result, general funds should not be needed to resolve this issue. And as next steps, we are partnering with DBM to review the for FY 2024 non-budgeted clearing accounts and in FY 2025 clearing accounts right now. And part of our practices to ensure fiscal integrity are being closely monitored and ensure proper reconciliation of these expenditures and revenue posting as we do our quarterly allocations. And in regards to the Maryland Think reports, as mentioned previously, we concur with this report request, but we request the due date of December the 1st, 2025. Thank you, and we look forward to your questions.
Wonderfully thorough response, DHS. Thank you so much for that. We also were in receipt of your 75-page written response, probably the most thorough one we've gotten to date. So thank you for that. Do any members of the subcommittee have any questions? Delegate Heinbaugh.
Thank you, Madam Chair. I just want to start out by thanking you for the detailed explanation on MD Think. Obviously, when you just look at the numbers without having that information, it's kind of alarming. And you didn't mention it, but I assume there was a savings with shutting down those legacy programs as well. So maybe the cost isn't as bad. Harder to measure the improved efficiency benefits, I guess. But my original question was going to be about the pilot program you have. And I understand that it wasn't used in 24 for some reason. And you answered one of my questions about, I think you said there have been 55 scholarship awards so far this FY. I'm just curious, two things really. Geographically, where did most of those recipients, what part of the state did they come from? Were they from all over the state, like my neck of the woods out in Western Maryland? And I'm curious too about what was the average amount of the scholarships?
Thank you for those questions. I do not have the immediate data that you're requesting, but we will absolutely provide that to you.
So I assume that you still have positions that allow people to work remotely?
Yes, we are in compliance with the negotiated telework agreement with the unions, and we follow that as our guidance. So yes, we do allow telework for a significant number of our staff.
So that's encouraging to me because that would lead me to think that there are opportunities in Western Maryland for these jobs then, where they're not going to physically relocate, but if they can get a good state job, that would be very attractive to people in Western Maryland.
Yeah, one of the things I would remind is that the pilot program itself focused on Baltimore City, Baltimore County, and Prince George's County. We are certainly interested in any conversation you would like to have about potentially expanding that focus.
Thank you. Thank you, Madam Chair.
Thank you, Delegate. Thank you, team, for the answers. Any further questions from, yes, Vice Chair?
I got it.
Thank you so much. Could we turn to page 10, the administration, let's see, 10. The administration reports that MLSP deficiencies is due to rising legal service contracts. Do you have data on how much those contracts have risen?
At this moment, we do not have that data, but we can certainly provide that to you.
Okay, thank you so much.
No problem.
That would be appreciated.
Thank you. Questions from members? Delegate Ruff.
Thank you, Madam Chair, and thank you to the DHS team. I wanted to touch on the $100.2 million deficit on the non-budgeted clearing account. How did it come that DHS wasn't aware of this until December of last year?
Sure. So again, with the processing of, the expenditures for two of our main accounts that use special funds, which would have been our low income, it's the Universal Services Program, EUSP, and our OHEP program, as well as Child Support Administrative Services. The way the funds come into us, they always hit a clearing account coming in from GAD. And to do the reconciliation, there are multiple data sources that we have to pull to be able to pull this information together. The previous leadership that we had within OBF was to monitor these accounts, and unfortunately, they were part of an oversight with monitoring data from other sources as well. And when we reconciled with GAD, they made us aware that we did have these revenue sources sitting in this account that needed to be moved to the actual funding sources. And so that's why we're moving forward now to do so.
Okay, and yeah, let's talk about the close monitoring that you all are planning to do quarterly. Can you give us more detail on the measures that you all are taking in that close monitoring to ensure that this type of financial oversight doesn't occur again?
Sure. And so as part of our quarterly allocation process within DHS, we have put together some procedures and some steps that will help us to make sure that we're pulling all of the reports and all of the data processes that we need to do the reconciliation. In addition to, we are also working with our partners again at GAD to make sure that any type of revenue that is coming to us, that they are also seeing those revenues allocated to the proper sources on a quarterly basis, instead of just waiting to the year-end process to reconcile these accounts.
Okay. One other question, Madam Chair. This is not a question that I had coming into it. Is it Mr. McLaughlin?
McLaughlin, yes.
McLaughlin?
Yeah.
Sorry about that.
No.
You were mentioning kind of the fact that all these different agencies kind of are responsible for these applications, and that you want to kind of drive the kind of responsibility back to those agencies. Are you suggesting that the agencies, well, the costs of MD Think that are budgeted to DHS should maybe be reflected in their budgets?
So I think we're going into the direction of trying to make sure that each of those applications have the appropriate budget allocated in their area. So yes, a portion of that would be in either their budgets or by reimbursable funds, the way that we're talking about now, would at least be able to be a one-to-one understanding of that portion of the overall 157 is actually allocated for specific agency use through reimbursable funds. The other thing we want to be able to draw a clear distinction on is the difference between the platform with which these applications operate on and the applications at the agency level. Because I think there's at times an assumed responsibility on the part of certain agencies to either bear the weight of the costs or the operational responsibilities that really are in fact distributed more broadly.
And just the last thing, are you able to kind of give us a estimate on the optimization of costs that you were talking about holistically? I mean, it's probably a really tough analysis to make, but I don't know if you have anything to offer to that vein.
So we would be able to look at utilization reduction. So what I mean by that is how much it costs for us to consume cloud services. Think, it's kind of like a metered service. Whatever you use, you pay for. And in a lot of the ways that we've been able to optimize services, we've actually been able to reduce those utilization costs. Some of them are realized that we would be able to go back and identify what those costs specifically are and report that back. There are others that we have planned utilization reductions. So we've got changes that we're currently making. It's almost like you build it, and the result of building it will allow us to then reduce the costs associated with the services that otherwise would have been consuming it.
All right, thank you, guys. Thank you, Madam Chair.
Thank you, Delegate. Thank you, team. Delegate McCaskill.
Thank you, Madam Chair. Thank you all for being here. Always a pleasure to see you. So, Mr. McLaughlin, since you out MD Think Executive, this may be for you. I'm referencing page 17 and 18, Exhibit 4. I'll give you a second. All right. There's something in the report called the Agile Scrum Teams. And we've noticed that there has been about $131 million that have or will be used for this, with the stated purpose of short, focused cycles to deliver incremental change. I have two questions. Given the significantly expanded scope of the entire MD Think project, can the agency provide an update of how projects and their progress are being managed from a more macro perspective?
Sure.
Perfect.
So the way that we look at managing these are, I talked about the roadmap before, kind of a 2-year plan, but really that is the macro of the macro. Once we start to get to smaller groups, we are able to actually realize what work is being done in small chunks, 2-week periods, and how those build up to longer cycles, which would be more of the macro component, that would be on a quarterly basis. And really, we manage a lot of our work on a quarterly basis. We call them program increments. They're called PIs. And that's really the way that we look at how progress is being made on the course of, over the course of the work that's being implemented. It also allows us to make sure that we can adjust our teams accordingly, so that if we don't have the right team, the contract you mentioned before, if we need to adjust adding a resource or removing a resource skill set, we can go to that contract and replace people based on what those look like, and we evaluate that on a quarterly basis to make sure that we've got the right teams in place.
Oh, perfect. So my second question really was about teams and the efficiency of communication to make sure that the development is going as planned.
Correct.
Okay.
And what we have implemented to account for that is sign-offs on the part of the actual application owners or the agencies. So for example, if you ask for something to be built and I go away and build it, and I come back to you and I say it's done, and you don't think it's doing what it was supposed to do, it's not done.
Perfect.
So you have to sign off in order for us to make sure that that then is available. So if it doesn't meet your expectations, we fix what's not meeting it, and then we ask for sign off again.
Perfect, thank you. Thank you, Madam Chair.
Thank you, Delegate. Thank you, team. I have some questions about children receiving appropriate care. So on page 6 of the DLS analysis, I want to thank you for your response to the stagnant improvement in the percentage of cases when children receive appropriate physical and mental health services. I'm sorry, this might actually be page 6 of your response. So your response lays out a number of things being done to improve this rate, but the rate of improvement is still very low. When were these measures started, and when do you expect to see significant improvement on the rate of children receiving appropriate physical and mental health services at this time?
So again, this, what you hear in Exhibit 1 on page 7 of the analysis is a small sample of the cases that the Citizens Review Board does. And what we have in our response is actually looking at the total population, and you'll see that there's improved outcomes as you look at the total population. We continue to work and have challenges around dental health, and working with providers. We've put in some place working with providers so that we can ensure that our children have access to dental services as well, and we will continue to do that work. And so we've seen improvement, and we'll continue to work to see improvement with our providers and our healthcare, working with our healthcare providers in the state.
Awesome, thank you so much. So the next set of questions is related to the data accuracy challenges that the department has experienced. Madam Principal Deputy Secretary, I know in advance of this meeting, we talked about how we would likely ask questions about the Baltimore Banner's article titled, "Maryland Recorded an Alarming Rise in Child Deaths from Abuse and Neglect No One Noticed." This was from February 3rd of this year. So I want to talk a little bit about the findings of data privacy and data accountability that are found on page 20 and 21 of the DLS analysis, and talk a bit about how that may or may not relate to some of the content shared here in this Baltimore Banner article. So the Banner reported that in FY23, 83 children died at the hands of their caregivers. And we all know that even one such death is one too many. So Lily Price of DHS is quoted as saying that data reporting from the agency might not be accurate. So can you share a little bit more information about how this data is inaccurate?
Sure. Thank you, Chair Shetty, for this question. And to your point, one child death is too many deaths. I do want to say that the 83 are not all children who have been in our foster care system or attached to our foster care system. We get reports of child fatalities for any child who dies, and we get a call through our hotline. And then what the data integrity issue is that we have there is that when we were reporting to the federal government, now NCAN's report, we were reporting all of the calls that we got and not just the calls that were connected to child abuse and neglect, so indicated finding of child abuse and neglect. We have gone through and manually looked at all of those cases to identify the proper number of cases, and we will be doing a resubmission for our NCAN's report. And with that, we'll see that we're more aligned with where the national standards are. I don't have that data with me. I will have that data when I see you on Monday. And so we can talk in detail around the data and the numbers. I will say, if I recall, there was only one child who had been reunified with their parent, who had subsequently had then died as a result, a contributing factor of maltreatment.
Okay, thank you. I sort of the second follow-up along these lines is, so I'm not sure which report indicates this. It might be the Banner article notes that 15 children in 2023 were returned to their parents or guardians who had previously lost custody. 15 is the highest number of children returned to potentially unsafe conditions out of any other state. So I know many of these decisions happen at the juvenile court or in family court and not by the administration. But in coordination with the courts, how are your family reunification decisions made? What types of supports are provided to ensure a safe transition back
And so
into
that's the
care?
number that I also believe that is inaccurate, and we'll have the updated number for you when we see you on Monday.
Okay.
But to your question around how we work with the courts, so all of our children who enter into our foster care system, they all also have an attorney assigned to them. So the parent has an attorney, the child has an attorney, and then these cases are heard in juvenile court. We develop service plans for families, and those service plans address the unique needs of why that child has come into the foster care system. And once those issues are addressed and we believe that the risks have been reduced and we present that evidence to the court then determines whether or not the guardianship will be released and returned to the parent. These decisions are made in the instance of then, today, and oftentimes these children may have been home 12 to 24 or even longer months before another incident of abuse or neglect happens. We also know that in our kind of looking at the data, a lot of times what we see are co-sleeping as death for children, as one of the primary kind of reasons why children suffer death. And oftentimes that is indicated as a maltreatment because we'll indicate that as neglect. Sometimes it will be drowning. A child may drown in a pool. We will indicate that as maltreatment because we will indicate that as neglect. So there are various reasons why these indications have, and we'll have more details around the numbers and the more accurate numbers when I see you on Monday.
Okay, great. And it sounds like, so all of the questions I have relate to the data reporting mechanisms and transparency over what happens to these children. And so perhaps we can table these questions for Monday's discussion at that point when we have a little bit more insight into the numbers. The last question I had is on page 14 of the DLS analysis related to personnel. So the DLS's report indicates that the agency is requesting 3 additional regular positions, but also notes that there is an 8.29%, 63-person vacancy rate. And so I want to understand, it looks like 9 of those vacancies have been there for over a year. Can you talk a little bit more about maybe whether any of the vacant positions could be converted to cover the needs of the 3 new positions you're requesting?
I'll let my colleague, Mr. Wade, take that one.
Thank you.
Yeah, thank you for your question. First, I want to point out the success that we've had as a department in filling our vacancies consistent with the governor's rebuilding state government initiative. We sit here today at about 7.8% vacancy rate across the entire department. On January 1st, 2023, that was 15.2%. So we've been very intentional about the way that we look at our positions and the way that we deploy those positions for various resources. The other thing that is important to remember is, we are at 16 positions, we're actually 16 positions over our turnover rate. So we really technically only have 16 positions, not 63, that we can use for those needs. Given all of that, and sort of the premium that comes with positions and an understanding that as our responsibilities expand, we need to make sure that we're not under-resourcing our efforts to meet those responsibilities. We look at, in every case, is there an opportunity to redeploy a position to take care of a need, or do we in fact actually need additional positions? In this particular case, I'd be very honest, I don't know the exact need for the 3, but we can go back and look at that. But I can say that as we make a request like this, we have gone through a check down of what resources do we have available, what resources do we need, and is it possible to redeploy a position?
Okay, great. So you'll follow up then with that data on these 3 positions. Great. Thank you so much. That concludes questions from our committee members. Thank you so much, GHS, for your thorough responses. That concludes the budget hearing for DHS administration. We will now move to MDH Public Health Administration, and we will invite DLS analyst Naomi Kimura to join us at the table. When you get there, you can begin when you're ready. Thank you.
All right, good afternoon. My name is Naomi Kimura. I'm the budget analyst with Department of Legislative Services, and I'll be presenting the fiscal 26 budget for the Public Health Administration in the Department of Health. So the total fiscal 26 budget for PHA grows by about $31 million to $320.6 million. On page 2, we've noted a couple of budget actions taking place in the fiscal 25 budget, including a cost containment measure authorized by the Board of Public Works in July of reducing the core public health services funding for local health departments by $12 million. We've also noted that in fiscal 25, the Department of Health has added $25 million in supplemental funding for local health departments due to the availability of American Rescue Plan Act funding. On page 3, the fiscal 26 budget is broken out by purpose. So the largest portion of the budget is allocated to local health departments. That's $113.5 million in fiscal 26. There's also a one-time expenditure in the fiscal 26 allowance that takes up about 15% of the budget. That's $49 million for services related to COVID-19 response. That is not eligible for reimbursement by FEMA, and so the department has used general fund dollars for those services. Pages 4 and 5 summarize the main changes between the fiscal 25 and fiscal 26 budgets. So again, the total budget grows by a little over nearly $31 million. And the biggest changes are that one-time COVID services expenditure that I just mentioned, as well as the one-time enhancement due to ARPA funds for local health departments in fiscal 25. At the top of page 5, there's also a couple of changes related to some program realignment within the Department of Health. Some harm reduction services are moving, substance abuse block grant funding is moving from PHA to the Behavioral Health Administration. On page 6, we've summarized some of the personnel trends over the last couple years in PHA. The fiscal 26 allowance includes nearly 600 regular and contractual employees. And there's a change between fiscal 25 and fiscal 26, net change of 7 regular positions. And that's just due to transfers within the Department of Health. So there's 7 regular positions moving from the Office of the Chief Medical Examiner and the Office of Preparedness and Response to other areas of the Health Department. As of December 31st, 2024, the agency had 105.5 vacant positions for a vacancy rate of 18.65%. DLS has asked PHA to comment on the reason for these vacancies and the impact that the vacancy rate has on PHA operations. Page 7 begins the main discussion for the analysis, which has to do with the core funding for local health departments. The state is required by law to support local health departments with core public health services funding. And the law states that through fiscal 2024, that amount is based off of a baseline amount that is adjusted each year by population and inflation. The statute also says that in fiscal 25, that the base amount, the formula amount, be at least $70 million, and then in fiscal 26 be at $80 million. And so if those minimums are met, then the formula growth is not applied. As I mentioned earlier, the fiscal 25 working appropriation includes the $25 million enhancement from ARPA funds, as well as the $12 million reduction approved by BPW, and totals $128.8 million for core public health services funding. There's also funding, before I get to that, DLS has asked PHA to comment on the breakdown of that $25 million enhancement by jurisdiction. The local health departments also get funding for COLAs and salary increments for any state employees that are in their employment. Different local health departments employ a different balance of state versus local employees. So this amount's going to vary by jurisdiction. DBM has indicated that for fiscal 25 COLAs and salary increments, they budgeted $7.4 million centrally in DBM. Later in the budget year, they realigned that funding. In fiscal 25 and fiscal 26, because the minimums that I previously mentioned were met, the formula growth factor was not applied, and therefore any increase in the appropriation would be due to COLAs and salary increments. However, the fiscal 26 allowance increases by $9.7 million, about $2 million higher than the amount budgeted for the COLAs and salary adjustments, and so DLS recommends cutting that unexplained increase. DLS is also asking MDH and DBM to provide the total amount of funding allocated for COLAs and increments for state employees at local health departments from fiscal 21 through fiscal 26, and to provide salary information and the number of state employees that are used to calculate these salary adjustments in fiscal 25 and fiscal 26. Exhibit 3 on page 9 shows the amount of core public health services funding in each jurisdiction in fiscal 25 and in fiscal 26. And so from that chart, you can see that the jurisdictions that did receive an increase during this time are the ones that employ state employees. On page 10, gets into discussion that includes a couple of concerns that DLS has raised related to the current application of the statute. First, in budgeting COLAs and salary increments and the growth factor, this approach applies 2 different growth factors to the local health department funding. The second issue is that local health departments are only going to get an increase in fiscal 25 and fiscal 26 based on the number of state employees that are on their staff, even though there are population changes and inflation changes impacting their expenditures. And then finally, the core public health services funding is budgeted as grants, as a lump sum, rather than having the salary increments budgeted separately. And so, for example, for fiscal 24 COLAs, they are a part of the fiscal 24 actuals, not budgeted separately for the salary adjustments. DLS is recommending that the committees add budget bill language stating the intent of the General Assembly that beginning in fiscal 27, COLAs and other salary adjustments are budgeted in a separate program from the core public health services funding, and that the formula growth factors year over year are applied only to that core public health services funding, not including salary adjustments from prior years. Finally, the analysis discusses the local match requirement. Legislation requires local health departments to match up to a certain percentage of the state funding allocation, and in recent years, meeting that match has been a challenge for some local health departments because the appropriation has grown pretty significantly. Exhibit 4 on page 12 shows the changes between fiscal 2021 and fiscal 2025 in the match requirements for each jurisdiction. I'll also note that the local health departments can request a waiver or an adjustment to their match requirement from the Secretary of Health, and those are awarded at the discretion of the Secretary. In fiscal 2024, 5 health departments requested these adjustments and received them. DLS has asked MDH to comment on why it is appropriate to require a match of state funds for salary adjustments for state employees, because as I mentioned earlier, the appropriation does end up including those salary adjustments, and so that is what the percentage match is based on. Finally, DLS recommends restricting $250,000 of the appropriation contingent on the fiscal 27 budget submission, including a separate program for core public health services funding formula, excluding the salary adjustments, and also reduces, excuse me, a reduction of $2 million for the core public health services funding in fiscal 2026. And that concludes my presentation. I can take any questions.
Thank you so much for your thorough analysis. Do any subcommittee members have questions for our analyst? Seeing none, thank you. We'll now call upon our agency witnesses, Dr. Kalyana and anyone else you'd like to bring up. It's just you today?
Just me.
Awesome. Welcome back. We like having you here. And when you're ready, you may begin. Thank you.
Absolutely. So thank you. Good afternoon, Chair Shetty and members of the subcommittee. For the record, I'm Dr. Nilesh Kalyana, the Deputy Secretary for Public Health, the Maryland Department of Health, and here to speak about the Public Health Services budget. I want to thank Naomi for her analysis and for working with us over the past few years. As a reminder, we were here for the Prevention and Health Promotion Administration, and we'll be here for the OHCQ budget, I think, tomorrow. But PHS, the Public Health Services, is all of the other pieces that fall under us, which is the local health departments, the Office of the Chief Medical Examiner, the Laboratories Administration, our Vital Statistics Administration, our Office of Population Health Improvement, our Office of Preparedness and Response, and our State Anatomy Board. And every day these teams are providing foundational public health services and create conditions to ensure the health and safety of Marylanders. And oftentimes these services really go under the radar. They are the backbone of public health services. Just a few key highlights. I had mentioned previously our work on the boar's head listeria. Well, our labs were the other part of that, and they were leading the way on that. Our labs also is one of 2 state labs in the country that does PFAS testing, and so we're also leaders in that in the nation. Our Office of the Chief Medical Examiner went through a few rough years, but has really found its footing again and is back to operating as leaders across the country in the space of medical examinations. And of course, I want to note that, with the continued uncertainty at the federal level, our teams are taking time on top of what they're doing to try to understand and interpret guidance as it comes down. It's challenging for staff who really want to think about public health and how to advance that every day. And so I just want to take this opportunity to acknowledge all the work that is done across all of those administrations that I noted, including our local health departments in each of the counties across the state. You have our written response to the analyst questions, so I'm going to just highlight a few of the items here and really focus on the core funding, the LHD core funding, since that was 5 to 6 items here. When we think about the core funding, there are 3 pieces to that are at play. One is the allocations to the counties. The second is the growth formula, how much that allocation increases each year. And the third is the local match, how much the county needs to put in for the state's contribution. We're not going to talk about the allocations. Those were set in 1996, and we haven't really discussed those in either the JCR that we submitted or any of the other venues. But the growth formula was one of the items of the analysis, and the growth formula is applied to the base. And so we do concur with that recommendation from DLS that the growth formula be applied only to the base funding, because salaries are adjusted and grow by their own, grow by a separate metric that's controlled by DBM. The other piece I want to discuss about the core is the local match. And the local match is based on both the base and the salaries. The base and the salaries represent the state's portion of local funding that goes to jurisdictions. And so the local match that is provided by the counties is based on both of those items, because we always base that state contribution on the appropriated funding, which includes both salaries and base. And so that's why we have and we will continue to apply the local match to the entire appropriated amount, base plus salaries. And then the last item I wanted to touch on was the $2.3 million that were identified by DLS, and we do respectfully disagree with the recommendation to reduce that allowance. That amount that's included in FY26 represents the full annualization of FY25 salary enhancements that have not yet been brought into the 2025 budget. And so if this action were taken, it would leave LHDs without adequate FY26 state support for FY25 salary enhancements. And so with that, I'm happy to take any questions that you have.
Thank you so much for your testimony. Do any members of the subcommittee have questions? Delegate Ruff.
Thank you, Madam Chair. And thank you, Dr. K. I'm not going to butcher your name again.
You're good.
I apologize for last time. So I wanted to talk about something specific on page 16 in the appendix number 2 there, related to the audit findings in the DLS analysis. It talks about the Office of Provider Engagement and Regulation, and that there hadn't been the required biannual inspections on assisted living facilities licensed to dispense controlled dangerous substances. Could you talk about why that inspection did not happen, what has been done since this analysis was performed, and whether that has been rectified?
So that inspection wasn't done. And so for background, our Office of Provider Engagement and Regulation does these inspections for CDS, for facilities with CDSs. So I know we're focusing on assisted living, but this happens across a wide variety of settings. It is purely a staffing issue. We have worked diligently to address that staffing issue and to also address our record keeping so that we are on top of that issue. I think one of the operational challenges we had was there wasn't visibility into when we were falling behind on that. So really do appreciate this audit finding. We now have a new tracker system, and I believe at this point we are actually caught up. When these audit findings came out at the end of last year, we were already in process of catching up. But I will follow up with you, Delegate Ruff, to get you the date when we finally caught up.
Okay. So are you saying that the audit has been done at this point?
The inspections, you mean?
Excuse me, the inspection has been done.
Yes, I believe so, but I want to confirm and get you that information. But yes, we were already in the process of catching up when that audit finding came out.
And can you just give us a little bit of the detail on what those inspections entail as it relates to controlled dangerous substances at assisted livings?
So it's not specific to assisted livings per se.
Understood.
It is, but what the inspection is really about is making sure that there are controls in place for the CDS medications. So some of the examples are locked, that medications are locked behind 2 keys, that there are 2 people verifying the stocks, that there are processes for recording and administering the medication to ensure that the person who it is prescribed for is getting it. A lot of the failures we might see are when only one person is responsible, and so that's the situation where you might see diversion or misuse.
And I guess the last question is, how is it that the department did not have personnel to make sure that that's very important inspection was being done at our assisted living facilities?
You're correct. So the reason I mentioned that we're inspecting a lot of different types of settings, including pharmacies, assisted living facilities, clinics, and so it wasn't just that we weren't paying attention. We were trying to make sure that we were getting to all of the different facilities. But I'm happy to follow up with you about exactly what happened there, because once we found out, we started to make sure that was addressed.
So, okay, I'm a little confused. What other types of facilities does this department perform such an inspection on?
Pharmacies, clinics, and other places where where people are keeping CDS to administer.
Okay, and so all
Or
the
to
other,
dispense, sorry, or to dispense.
all the other types of facilities that you are required to have these biennial inspections for CDS were performed, correct?
Not all of those are we required to. There are different requirements. So I don't want to misspeak about which requirements, but I'm happy to get you, like, which facilities have which requirements.
So were there any other types of facilities where biennial inspections were required that did not get done in the last year?
That's what we're asking. I've actually, so I'm glad you asked that question. I've asked my staff to make sure that we are up to date on all of our other inspections as well.
Okay. Thank you, Madam Chair.
Thank you, Delegate. Thank you, Doctor. Other questions from the subcommittee members? I have one really quick. So you spoke briefly about funding for local jurisdiction match rates, and I just want to ask a quick question related to that. So it's the section that this is noted on are pages 11 and 12 of the DLS analysis. So I want to talk a little bit about this further. Can you speak to any long-term effects that you might anticipate if the salary adjustments are removed from the local match?
If the salaries are removed from the local match, that will decrease significantly what is then required at the locality and will effectively be a cut to local public health departments.
Okay, thank you. All right, Delegate McCaskill.
Thank you, Madam Chair. I have a few questions, if you will indulge me for a moment, on Appendix 6. Perfect. So I have a few questions, and I'll direct many the others to you all and copy in DLS, but specifically line 4 and line 8. So for line 4 for travel, we have a budget increase of 44%. Could you just expand on that?
Yes, so that is entirely from federal funding. So we have a grant called the Public Health Infrastructure Grant from the CDC that provides flexible public health core funding to states. And so the increase in travel there is entirely from that grant and from which are federal funds.
Perfect. Line 8, contractual services. There's a proposed $47.6 million increase for contractual services there. Is this for technology revamps, or is this a mixed-use type increase?
So this is actually related to COVID dollars. So initially these were ARPA dollars that now needed to be replaced by state funds. And so what you're seeing there is that COVID replacement dollars.
Okay, I have two others, but I think I'll just follow up with you with the agency. I want to specifically go to the Office of Chief Medical Examiners. I have just a few questions with that. On page 6, personnel data. Walk me through this.
Sure.
Okay. So we know that the Office of the Medical Examiner's Office has been plagued with backlogs, et cetera. So I was reading in the vacancy turnover that there is an appropriation due to internal transfers to other MDH from specifically Office of Chief Medical Examiner's Office in 6 positions. But I did hear you say something really nice, that you said you found your footing. How's that working with personnel? You found your footing, although there was a transfer from that department? How are we with, and we may need to follow up as far as backlogs and completion, et cetera.
Sure. Right now, so where we are, there's a wide range of types of staff at the OCME. In terms of our medical examiners, we have 20.5 FTE allotted for that, and we have 16 of those positions are filled, with the remaining work being done by contractual medical examiners to pick up the remaining workload of the 4 that we haven't hired yet. In terms of where we are at over 90% completion rate for exams and autopsy reports within 90 days, which is the national accrediting standard. So we are exceeding that at this time. We're also within the workload standard. So the workload standard is between 250 to 325 cases per medical examiner, and we're just under 300 at this time. So we really have caught up with the backlog. We are on schedule. There are always a few autopsies which take longer because of either investigations or additional data needed, but those are normal and routine.
Okay, perfect. Madam Chair, one last question, I believe. So that's really good to hear that you are within the national standard. So congratulations with that. However, I just want to make sure that we want to make sure that we are not quantifying over quality. And I know that some of the some concern was around your analysis for the medical examiner's office being used biased methods to return scientifically unfounded findings. So I just want to make sure that we're not compromising the quality of these reports to say that we are at that 90% versus, the quality of it, making sure that we are not going back to these unfounded findings.
No, we're not compromising quality, and that's actually why we're using those contractual medical examiners, is to make sure that we're distributing the workload so people can do the work they need to do and do it properly. So our new chief medical examiner, Dr. Dean, who's been there for a little less than a year as the chief, but has been there for many years as a medical examiner, has really made it one of her priorities to make sure that we maintain and actually increase our academic engagement, both with our academic partners and at the national level as well. So quality is baseline to what we do.
Perfect. Thank you. Thank you, Madam Chair.
Thank you, Delegate. Thank you, Doctor. I see here that Vice Chair Jones had a question related to systems integration and modernization. So rather than ask it on her behalf, I'll just ask her chief of staff or her to follow up by email with you and your team, and we'll copy the DLS analysts as well. Sure. Okay, I think that concludes questions for you. Thank you so much for your time today, and we will see you again very soon. I see we have an individual signed up favorable with amendment, Dr. Rhonda Porter with AFSCME Local 1170, Prince George's County. I don't see them here, though. And they're not online virtual? No. Yes? Oh, you had one additional question. Yeah, I just thought about it. Oh, I'm sorry. Can you come back up, please? Just one more question, since you're here still. Thank you.
I know, I'm sorry. I apologize. I saw something at the last minute that I wanted to just ask about. And let me make sure I'm asking the right, okay, yes. It was about the reduction in the Maryland Loan Assistance Repayment Program. Can you just tell us, I think it was a one-time supplement for that program, and that is dedicated to nurses. And it seems like dedicated to nurses in kind of underserved areas. Is just because that was a one-time supplement, so now it's back to $1 million, or what's the reason for the appropriation or the designation there?
So you're right. That $2 million was a one-time increase in the appropriation to $3 million for the nursing program, and then it reverted to the $1 million appropriation. So that's just in statute.
Is there any intent potentially in the out years to restore or to try and add more supplemental funds to that assistance program?
I mean, that's part of the budgeting, so I can't really, we'd like to see that there's more funds put into that program, but we can only work with what was appropriated to us.
Okay. Thank you. That was it.
Thank you so much. Thank you for coming back to the table. Okay, it looks like our one witness that had signed up favorable with amendment is unavailable today, so that will conclude the MDH Public Health Administration budget hearing, and we will now turn to the Department of Housing and Community Development. Mr. Scott Benson, please join us at the table, our DLS analyst, and you may begin when you're ready. Thank you so much.
All right. Good afternoon, Madam Chair. Today I'll be presenting the operating analysis for the Department of Housing and Community Development. The mission of the Department of Housing and Community Development, or DHCD, is to work with partners to finance housing opportunities and revitalize great places for Maryland citizens to live, work, and prosper. The department's programs are administered through 3 operating divisions: the Division of Development Finance, which includes the Community Development Administration, the Division of Neighborhood Revitalization, and the Division of Credit Insurance. As you can see from the operating budget summary on page 1, the fiscal 2026 budget increases $42 million, or 8.1%, to $558.6 million. Special funds increased by $24.7 million in the fiscal 2026 allowance, or 18.8% compared to fiscal 2025. So DHCD uses both budgeted and non-budgeted funds to address Maryland's housing needs. You can see this in Exhibit 1 on page 5. Approximately 74% of DHCD's funding in fiscal 2024 came from non-budgeted revenues, such as bonds, securities, or tax credits. DHCD's budgeted DHCD's budgeted federal and state funds account for 15% and 11% of the department's total funding. DHCD's funding from all sources totaled $2.6 billion in fiscal 2024, with homeownership and special needs housing overtaking rental housing development as the largest component of DHCD's expenditures in fiscal 2024, accounting for 40% of expenditures. Moving on to performance analysis. The first topic to discuss is homelessness in Maryland. It's increasing, however, still below pre-pandemic levels. As you can see in Exhibit 2 on page 6, showing the chart showing homeless individuals in Maryland. Between January 2023 and January 2024, Maryland's count of homeless individuals increased by 3% to 6,059, compared to an 18% increase nationally. Overall, this measure of Maryland's homelessness levels declined by 28% between calendar 2015 to calendar 2024, while homelessness nationally increased by 37%. Now, for the Homelessness Solutions Program, or HSP, the fiscal 2026 allowance includes $19.1 million in general funds. This is a decrease of $500,000 compared to what was appropriated in fiscal 2025. As of January 2025, HSP has allocated $18.3 million in its fiscal 2025 appropriation to homeless services. You can see that you can see the funding by purpose in Exhibit 3 on page 7. Now, as shown in Exhibit 4 on page 8, HSP provided assistance to 9,985 people in fiscal 2024 who were homeless or at risk of becoming homeless. This is a 3% decrease compared to the 10,312 people assisted in fiscal 2023. The number of people exiting homelessness to permanent housing similarly decreased by approximately 4.6% between fiscal 2023 and 2024. Moving on to failure to pay rent evictions and foreclosures. You can see on page 9 in Exhibit 5 the number of failure to pay rent cases and evictions between October 2019 to September 2024. Evictions began to decrease in the fourth quarter of 2023 and continued into the first quarter of 2024, but have since remained relatively stable from that point, staying around 3,900. In Exhibit 6 on page 10, you can see the number of notices of intent as well as notices of foreclosure filed in Maryland with the Office of Commissioner of Financial Regulation. So both measures sharply increased following the end of protections in June 2021, but generally they remain below pre-pandemic levels until calendar 2024. This is when NOIs increased above 20,000. Now, in the fourth quarter of calendar 2024, NOIs totaled 21,057, or 15% higher than the fourth quarter of calendar 2019. Despite the increase in NOIs, NOFs have decreased 40% between the first quarter of calendar 2023 and the fourth quarter of calendar 2024. Moving on to the implementation of legislative priorities. Section 21 of the fiscal 2025 budget bill added a total of $14.1 million in general funds in DHCD's operating budget. These are a few of these actions. Few actions approved by BPW deleted $250,000 from these additions. You can see on page 12 in Exhibit 7 the legislative additions, with the largest being $5 million for the emergency rental assistance. On page 13 in Exhibit 8, you can see the fiscal 2025 deficiencies. DHCD received a total of $2.9 million in deficiencies in their fiscal 2025 appropriation, with the most going to the Division of Development Finance to provide additional funds for the Homeowner Assistance Fund Critical Repair Program, as well as the DDA Rent Subsidy Program. In total, it was $1.3 million. Moving on to the fiscal 2026 overview of agency spending. You can see in Exhibit 9 on page 14, the largest share went to the rental services programs, which was $343.1 million of the $558.7 million overall, or 61%, while the second largest category was energy programs at $85.6 million, or 15%. Moving on to proposed budget change. You can see on page 15 in Exhibit 10, the fiscal 2026 allowance increases by $42 million. And this is primarily due to increases in energy programs such as Empower Maryland, as well as increases in rental programs such as the statewide voucher assistance program. And overall, funding for energy assistance programs in DHCD's operating budget has increased by $19.6 million, or 29.7%. This is after accounting for deficiencies to a total of $85.6 million. This increase is primarily driven by the increase in the Empower Maryland program, which will have a significant expansion in program activity to meet the goals set out in the Public Utilities Article 7224, which requires DHCD to implement policies that reduce greenhouse gas emissions 0.9% below baseline and introduce standards for who can be approved as a contractor. Partially offsetting this increase in the energy programs is a decrease of $6 million in reimbursable funds from DHS to the low-income home energy assistance program. Now, for rental assistance, the fiscal 2026 allowance includes $10 million in rental subsidies for the statewide rental assistance voucher program. Now, this was mandated by Chapter 446 of 2023. However, BPW had reduced the funding for the program by $2.5 million due to startup delays in July 2024, hence the $2.5 million increase in fiscal 2026. The largest increase in the rental assistance program occurs for the Section 8 program, including both increases in federal funds and for vouchers. Federal funds for vouchers, which was $5.5 million, and just general administration, or $25 million. Regarding the Infrastructure Investment and Jobs Act, the Weatherization Assistance Program, or WAP, has overall been awarded $45.7 million, but the fiscal 2026 allowance for this program decreases by $113,648, or 2%, to $5.5 million when compared to the fiscal 2025 appropriation. This funding is in addition to regular funds for WAP. Moving on to personnel, you can see that the number of regular positions increases by 1. Now, as of December 31st, 2024, DHCD has reported 26 vacant positions, of which 12 have been vacant for less than 3 months, while 2 have been vacant for more than a year. Contractual full-time equivalent positions decreased by 12 in the fiscal 2026 allowance compared to fiscal 2025. This net change results from decreases in a variety of different programs, including the rental services Program, the Office of the Secretary, and the Housing Development Program. Moving on to the key issues, broadband. So Chapter 74 had renamed the Office of Rural Broadband, DHCD, to OSB and expanded its responsibilities to include developing a statewide broadband plan, collecting and publishing data on broadband availability and speed, and also furthering digital inclusion efforts. You can see in Exhibit 11 on page 19, funding from all the sources appropriated for the broadband program across DHCD's operating and capital budgets through the fiscal 2026 allowance, totaling $710.7 million. Now, in DHCD's operating budget, the fiscal 2026 allowance includes $3.2 million of total funds, including $2.4 million in federal funds. This is primarily to support contractual services, and $782,000 in general funds for contractual full-time equivalents, as well as grants. Now, several broadband programs are continuing into fiscal 2026 and are expected to continue until December 2026, when all the funds they've received is expected to be expended. Those programs can be seen in Exhibit 12 on page 20. They include the Maryland Emergency Broadband Benefit, Connected Devices, Maryland Emergency Education Relief, Connected Communities, as well as digital inclusion. And Exhibit 12 shows the status of broadband programs funded in the operating budget, how much they've expended, as well as how much they've encumbered. Also to note, the Affordable Connectivity Program has ended. This was as of June 1st, 2024. It was a federally funded program through the Federal Communications Commission, under which eligible households within Maryland were able to receive $30 per month for broadband. And this brings us to the operating budget recommended actions. And DLS recommends reducing the fiscal 2026 allowance by one position due to the current 26 vacancies that could be reclassified. And that concludes my presentation. I'm happy to take any questions.
Thank you so much for your thorough analysis. Do any members of the subcommittee have questions? Delegate Acevedo.
Thank you, Madam Chair. Thank you for your presentation. I am looking at the graphics on the homeless population in Maryland, and I see there's a demographic breakdown, race, age, and whether the individuals are veterans or not. And I'm curious whether there's any data on LGBTQ youth and homelessness, or is that something that the department, do you know if the department tracks that?
I'm not entirely certain about that. That data came from the federal government, I believe.
Okay.
I can certainly look into it and get back to you.
Okay, thank you.
Thank you so much, Delegate. Thank you so much for your response. Any further questions from the subcommittee? Okay, thank you. Seeing none, we will now bring up our virtual witnesses from the Department of Housing and Community Development. And so I know we have Secretary Day, virtual waiting room, as well as a number of members from his team have signed up. I see Julia Glanz, Sergey Kuzmenchuk, Kenneth Fick, Gregory Hare. We'll now bring up our, I think whoever is coming in, if you can turn off your YouTube stream. We are going to start with, excuse me one second. Secretary Day available on the wait room? One moment, please. Yeah. Forgive us, we're trying to work out tech issues. Give us a moment, please. Secretary Day is joining? Okay, great. And then he might indicate which team members are here. Okay. Ms. Holly, are you with DHCD? Or are you an advocate here to testify?
Advocate to testify.
Okay, we're going to put you back in the wait room temporarily until we get to that panel, okay? Thank you for your patience. Hi, Secretary Day, it's good to see you. Can you hear us? Can you hear
I
us,
can hear
Mr.
you.
Secretary?
Can you hear
Great,
me
okay.
okay?
Yes, are there members of your team that you're aware of? Are they in the wait room? Should we invite them now to join, or you want to go it alone?
That's fine. There are.
There
And I
are,
believe
okay.
each of them has an individual link and they should be in the weight room.
Okay, great. I think we're working to get them in. Forgive us for one moment. We'll get everybody in. I see Julia Glanz is on my list, as well as Sergey, Kenneth, Gregory Hare, Danielle Meister, Ronnie Hammond, and Garrett King, all with DHCD. You have quite the team assembled today. Okay. Give us a second, please. Okay, give us just another minute. Thank you. While we bring in your team members, Mr. Secretary, do you want to begin with your testimony, or would you prefer to wait until everybody is here? I don't know how you've coordinated testimony. Is there an audio
Madam Chair,
delay?
can you hear me all right?
I can now, yes. Is there an audio delay for you? It would be wise to have, if you were able to listen through the Zoom link instead of through the YouTube channel. Can you hear me?
Yeah, if you'll give me just a second, I can. I'm hearing every other word or so. The Zoom link was working for me. Excuse me, the YouTube link was working as far as the audio. So if you'll give us
Yeah,
just a second,
but
just want to make sure that I'm
the YouTube has a delay, and so
okay.
it would be better if you're able to listen through the Zoom link, if it's an option for you.
Yes, ma'am. Give me 1 second, and I'll
Sure.
attempt that.
Okay.
I don't know if it's just me.
Okay. Do we have everyone? Okay. We think we might have your whole team here, so we're ready to go when you would like.
Okay. The delay seems to have stopped, and so I think technology is momentarily working in our favor. So if you're okay, I'll begin.
Yes, please go ahead.
All right, Chair Shetty, Vice Chair Jones, members of the committee, thank you so much. For the record, my name is Jake Day. I serve as Secretary of the Maryland Department of Housing and Community Development, and it's my pleasure to join you to discuss our proposed fiscal year 26 operating budget. As Governor Moore stated last week, 2 storms have hit Maryland at the same time. COVID funding from the federal government papered over what was a major inherited structural deficit. And he pointed to several of the reasons that we were in that position, not unlike many other states. Simultaneously, the stark new policy direction from the White House and an unpredictable Congress with potential to implement policies that could hurt Maryland's economy have coupled with that first storm to present a very, very challenging situation. The Moore-Miller administration has introduced a common sense budget guided by our commitment to growth and our dedication to helping Maryland emerge stronger than ever from one of the worst fiscal crises in 2 decades. In partnership, Maryland's Department of Housing and Community Development has been hard at work making Maryland more affordable for Maryland families. And our budget reflects a fiscally responsible approach. I want to express my gratitude to the Department of Legislative Services, to our analyst, Scott Benson, for their diligent work and thorough and fair budget analysis. And I just want to provide a few brief notes in response to recommendations and observations. In response to DLS's recommendation to delete the new position for financial manager and fill it by reclassifying a vacant position, the department respects
I think you might be frozen, Mr. Secretary. Anyone else want to
general
pick up?
funds.
Here we go. Oops, now we've lost him. Does anyone have his testimony? Would you like to read it on his behalf? Okay, we'll just wait for him to come back into the waiting room and let him right back in. There he is. Hello again.
Hello. I'm sorry about that. I don't know where
okay.
You last heard me.
I don't remember. Vacant positions. You respectfully disagree maybe
Yep,
with the
I'll start right
DLS
back there.
recommendation? Okay. Go ahead. Continue to
Yes.
disagree respectfully.
Very respectful. The increase in one permanent position is the result of a statutory mandate in House Bill 538 of 2024 to create a historic property revitalization director within DHCD and to provide a salary for the director in the state budget. General funds is the only funding source available to cover the cost of this position, as the position is not directly related to CDA operations, which would be the other funding source that the state potentially could tap CDA's proceeds. All other vacant positions are earmarked for specific DHCD operating needs with their corresponding funding sources. If the General Assembly doesn't provide the general funds for this position, DHCD will not be able to fulfill this statutory mandate due to fiscal constraints on our special funds. Responses on other requests from the analysis have already been provided in our written testimony, and I am looking forward to questions and conversations. So happy to take questions from the committee. I have with me our Chief Financial Officer, Sergey Kuzminchuk, Deputy Secretary Julia Gland, and a number of other leaders from our senior team.
Wonderful. Thank you so much for your testimony. Thank you, team, for joining us. Glad we could work through the technical issues. And huge thank you to our committee staff friend here who's working all of the buttons in the back. So let's go to questions. Do any members of the subcommittee want to start? Okay, I can start if needed. So I have a question related to homelessness and crisis response teams. So homelessness specifically. So on page 7 of the DLS analysis, I see that you all have the Homeless Solutions Program funding by purpose. Forgive me. There's 7% allocated for street outreach. Can you talk a little bit about what that programming consists of, please?
Yeah, I'm going to ask Assistant Secretary Danielle Meister if she can unmute herself and join me.
Sure. So street outreach looks a little bit different in every community, depending on the kinds of funding sources they're leveraging. But generally, it involves having case managers or mobile outreach workers go to folks who are unsheltered. So that could be living in a tent outside. It could be living in vacant or abandoned housing, but generally in a place not meant for human habitation, and taking case management work to them. So their job as a street outreach team is essentially to get people connected to income, benefits, and housing. And it's all services that are performed in a street setting generally. And some street outreach providers do also have a drop-in center component where they offer showers, food, other types of like emergency assistance for folks. But generally it's taking the case management work to the people to get them into housing and income and benefits.
That's amazing. Thank you for sharing that. Do any of these funds help support crisis intervention teams in counties? Because I know a lot of their work often intersects with the same population. So I'm curious if your outreach programs work collaboratively, or do you help fund? How is that relationship?
Yeah, each community again is different, but I would say it's very often for these funds to be commingled or used collaboratively with ACT team funds, mental health system funds, substance use treatment funds. Funds available under Medicaid, for example, can sometimes be used for this work. So many of the street outreach teams, we're a small portion of their budget. They're generally leveraging, funds from the public health system, from local behavioral health providers, as well as state and local dollars.
That's incredible. I'd like to follow up with you, please, if I may, with specifics on this. There has been an effort here in the General Assembly to identify opportunities for restoration to wellness, so related to the massive backlog of competency restoration cases that we see across the state. There's about half of them are in my county, and so there's been a lot of effort to identify potential solutions, given that a number of the individuals on this list are unhoused and are finding themselves in legal trouble and not able to access really appropriate medical care. And so I want to follow up with you later, please, to talk about how we might be able to marry some of that work. So I'll reach out by email. Thank you. Delegate Heinbaugh, did you have a question?
Thank you, Madam
Great.
Chair. I'm not sure who to direct this question to, so I'm just going to throw it out there. On page 16 of the DLA analysis, it points out that there was a significant increase in the budget for Empower Maryland. I believe it was a 70% increase, or about $24.5 million. I'm just curious about what's driving that. Is that a change in focus to rental units? I said another way, how will you use that money, the additional money?
Yeah, I can start, Delegate, and then I can ask Greg Hare, Assistant Secretary Hare, to jump in here. But the change in budget is simply a policy decision made by PSC. So they appropriate more funds to DHCD and to other agencies when they choose to increase the Empower rate. So that's not driven by us, but it's in the opposite direction. The way that we will use those funds is to fund both single-family and multifamily energy efficiency work. We do two different types of work. The multifamily is new construction, so we'll support the renovation and construction of energy efficient multifamily products, and we do the same for single-family renovations. So we have programs that are both take the form of grant and deferred loans for modifying the envelope and systems of single-family homes, usually severely income restricted, often senior households. Income restricted households, legacy homeowners, to address energy efficiency repairs. We also pair that with other funding sources to address critical repairs like roof issues, accessibility issues like steps and bathroom access, things like that at the same time. Assistant Secretary Hare, anything you want to add to that?
Secretary Day, I think you covered it well. Just as you noted, all this is really driven by the law that requires DHCD to meet certain energy savings targets. And so, as you indicated, therefore, reducing energy bills, weatherization, and other components in the single family and rental housing space.
And just one follow-up real quick. I should know this, and I don't. Can that money be used for rental properties as well?
Yes, I believe so. That
yes, that is correct.
It can and has been.
Okay. Thank you.
Yes.
Thank you so much, Delegate. Thank you, team. Further questions? Oh, I'm sorry, Madam Vice Chair.
Thank you so much, Chair, and thank you to the DHCD team. you have always been so very responsive in my district when I have reached out to your team. I again want to thank you. But something I'm hearing a lot from my constituents and is their worry and concern as we move forward with federal funding, the uncertainty, freezing, and the purposeful chaos feeling. So when I look at page 5, Exhibit 1, sources of your funding, federal funds, 15%. Federal tax credits make up 18%. Could you potentially illustrate how you all may be preparing should a freeze or something happen at the federal level happen to DHCD, or are there contingency plans? Better yet, what would that mean or look like for your agencies?
Madam Vice Chair, thank you for the question. Let me start off by saying that I'm sure all facets of state government are affected or would be affected by funding freezes, changes in federal allocations, and we're no different. We are on a daily basis consumed more and more with the analysis and positioning and preparing for various funding sources being frozen, delayed, or otherwise not arriving as we would anticipate to support our programs. The work that I'm sure, again, every agency of state government does can have life and death consequences, and shelter and housing is no exception. As you can imagine, when a voucher doesn't arrive, and look, there's been an attempt to dissuade concern from the direct to consumer or direct to resident funding streams, but we've seen disruptions across systems that would affect every type of funding. So when a voucher doesn't arrive, there's risk of eviction, right? In the setting of a court, and look, we're talking to the Attorney General's office, we're talking to the judiciary. In the setting of a court, it's possible that a judge wouldn't be able to hold the federal government accountable for that failure and would have no one to hold accountable but the tenant for non-payment, leading to potential eviction, potential foreclosure on properties as well. So the second and third order effects are extraordinary. Our response planning considers the effects on all of these things. I'll give you a good example of in the last 24 hours where we've seen a particular issue. We were getting ready to take to market a bond issuance that included 3 projects, 3 multifamily projects, including a renovation of a property. That property is sizable, talking 200 affordable housing units. A significant portion of the funds, significant enough that the project has to be removed from that bond issuance, is a federal fund which is frozen because of its connection to climate goals. So now let's remove words like climate goals for a second. Just think about the specific value of that. That's $10 million in federal funds that are simply designed to address inefficient energy systems that have to be replaced in the redevelopment of a property. The funding source is not a private loan. It's not, PNC Bank or M&T Bank or Bank of America. It's not state government. It's the federal government. And so that tool that was purpose designed, purpose built to do exactly that is on hold. And so we're experiencing the very real effects today. And those 200 families are experiencing the very real effect of a now delayed financing of the renovation of their property because of this delay. This is not a future problem. This is not a prospective problem. The consequences are real and they're happening right now. At the same time, I'll tell you, we're responsible for a significant part of Maryland's business lending portfolio, obviously with our partners at Commerce as well, and TEDCO, but we're watching the the significant amount of funds we're anticipating from the state small business credit initiative. We are dependent upon federal funding for the vast majority of our broadband deployment. So we're watching that carefully as well. Of course, it's my hope that most of these things will be sorted out, whether it's by the administration or through the courts. But I think the very real consequences, again, for those 200 families is an indicator of great concern. And it's something that, to me, looks like the first evidence of the freeze having a direct impact within our portfolio on our residents. I don't know if that answers your question, but hopefully just giving you some insight into the scale of concern and without being comprehensive, but trying to be illustrative.
No, it helps. And at the end of the day, we again are talking about families, shelter, and Marylanders who need us. So thank you so much. I appreciate it. Thank you, Chair.
Thank you, Madam Vice Chair. Thank you to DHCD's team. I see no further questions from the subcommittee members, so thank you for being here. I know we do have quite a few advocates who are signed up to testify both in person as well as virtually. And so typically when we have our secretaries and teams testify in person, we ask that out of respect for our advocates that come all this way to engage, that you please stay here and listen. We can't keep you in the Zoom room to do that because we've got quite a few people that are going to join us. So instead, I'd ask that you please continue to listen on the YouTube stream of this hearing, please.
Madam Chair, happy to. I want to just say once again, thank you for your hospitality and apologies for the technological challenge we had on the front end.
All good. We understand. Yes. Thank you so much for being with us today.
Yes, ma'am.
So for our next panel, we're going to call up our in-person witnesses who are here. And then what we'll do next is we will have our virtual witnesses all admitted. And then we will call upon them individually in the order that I have them listed. So the first in-person witness that I have today is Matt Hill with Public Justice Center. I'd like to also add to the panel Claudia Wilson Randall from Community Development Network of Maryland. And I would also like to ask Lisa Klingenmeyer from Maryland Family Network to please join. That's 3. And Kevin Lindemood for Healthcare for the Homeless. Okay, so our panel is full. You can go in any order you wish. 2 minutes, please, per, and then we will do questions per panel.
Sure.
Okay, and just introduce yourself so that we can mark you down.
Sure.
Thank you.
Good afternoon, Chair, members of the committee. My name is Claudia Wilson Randall. I'm the Executive Director of the Community Development Network of Maryland. I'm happy to be here in person through the snow, boots on. I want to speak today strong support of the DHCD budget. Our members across the state, from Garrett County to Anne Arundel County to Baltimore City to Montgomery County, all benefit from the various programs that the department puts out. This is a vital source of funding for our members and the people they serve, the families and households they serve, with really important projects for housing and community development. I did have 2 amendments, or 3 really things that I just really want to emphasize. The capital budget has been increased significantly in the last 2 years to $27 million for Bernie and $12 million for NED. Those are programs that are really critical to our members in the Central Maryland area and the DC region. And it's really important that we have operating dollars to move that capital. I can't just stress that enough. You have my written testimony. I just really want to be specific that we need 10% of that those capital dollars to be in the operating budget in order to move the capital. Folks are not going to be able to move $27 million worth of capital dollars with 499,486, I believe is the number that is currently in the budget. So I really would like to see those budget numbers be 10% of the capital budget numbers. So if it's 27 million, that we would have 2.7 million in operating dollars. And if it's 12 million in the National Capital Strategic Program, that we'd have $1.2 million in operating dollars.
Thank you.
In addition,
I'm sorry, your time is up, but I do see that you have submitted written testimony
yes,
as well.
absolutely, and
so-
my colleagues will handle my other point quite well. So thank you so much.
Thank you for being with us today. Who would like to go next?
Good afternoon, Madam Chair, Madam Vice Chair, members of the committee. My name is Matt Hill. I'm an attorney at the Public Justice Center, which is a member of Renters United Maryland, which strongly urges the committee to restore $5 million back into DHC's budget for eviction prevention funds. The eviction prevention funds, also known as emergency rental assistance, pay 1 to 3 months of back due rent to ensure the short-term crisis, such as a job loss or reduced hours, a medical bill, or even one of my clients recently had their car stolen. We don't want that to become a catalyst for homelessness, and that's what eviction prevention funds addresses. Last year, this committee led the charge in adding $10 million to the budget for eviction prevention funds. $5 million was for the community schools-based program, and there was another $5 million for less restricted eviction prevention funds. The current proposed budget maintains the $5 million for the community schools, but cuts the $5 million in less restricted eviction prevention funds, and that's what we'd like to see restored. This cut may result in a short-term budget gain, but it will be a long-term fiscal loss. We had a study done in 2024 showing that $10 million in eviction prevention funds would assist 3,747 families who are most at risk of homelessness in avoiding eviction. This then saves the state money, because I think, as my other colleagues will talk about in more detail, housing affects everything from healthcare to schools, things the state pays for or takes revenue from that are then impacted negatively by homelessness. And when we talk about DHCD not assisting as many residents with preventing homelessness or in homelessness as the budget analysis does, eviction prevention funds is one way to directly address that, because again, that money can get out the door and help people tomorrow to avoid homelessness. I'll just say one more thing. In my personal capacity, in my professional capacity, I represent renters who are facing eviction. We're much more effective when we have eviction prevention funds. And I'll see that my time is up, so I will stop there. Thank you.
Thank you for your testimony. I appreciate it. Who would like to go next?
Thank you, Madam Chair and members of the committee. My name is Lisa Klingemeyer. I'm the Deputy Director of Policy at Maryland Family Network, which works to ensure that children and their families have the resources and opportunities they need to thrive. We're here in strong support of the Department of Housing and Community Development and their budget, but we also echo the concern about the reduction in eviction prevention funds. In late 2023, a group of researchers for the first time took census data and combined that with eviction court data to see who is most likely to be facing an eviction in our country. And the answer is children under the age of 5 is the most likely population. In most eviction cases, including in our state, households facing an eviction have at least one person under the age of 18 in that household. And we know that housing instability is an adverse childhood experience. Once you face housing instability, that is a long-lasting impact. It impacts your ability to achieve in school, it impacts your ability to exceed in life thereon, and that is something that is extraordinarily difficult to come back from, especially for children under the age of 5. Eviction prevention funds really are a safety net program that we should be investing in and bolstering, and this cut is really concerning, especially as you all are investing in things like the Blueprint for Education, the Child Care Scholarship Program. Eviction prevention funds complement those investments, because a child in a classroom is not going to be able to learn, or a child in a child care setting is not going to be able to thrive if they're going home to an unstable housing situation. So we really strongly urge the committee to look at opportunities to support the eviction prevention funds and the Department of Housing and Community Development. Thank you.
Thank you so much.
Chair Shetty, members of the committee, my name is Kevin Lindemood. I'm the president and CEO of Healthcare for the Homeless, Maryland's leading provider of comprehensive healthcare services and supportive housing for families and individuals experiencing homelessness. We've also, several years ago, launched a wholly owned subsidiary called HCH Real Estate Co. So we interact with the department in a number of ways. Here to support the DHCD budget and the team assembled by Jake Day. In 30 years of doing this work at the intersection of homelessness, health, and housing, I've never seen a DHCD leadership so committed to addressing homelessness. I should point out that the recent Qualified Allocation Plan, or QAP, which sets the rules for the Low-Income Housing Tax Credit Program, includes a set-aside for projects that are meaningfully ending the homelessness of people experiencing it, and also has for competitive projects a requirement that all low-income housing tax credit programs have a 15% homelessness preference, 15% of all units going to families that are exiting homelessness, and we think that is just fantastic policy. It is important to note, I'll echo what was said, at a time when homelessness is increasing, when fair market rents have increased by 41% over the past 3 years, this is not the time to be disinvesting in eviction prevention, and so would ask that that $5 million be put back. And we'll also point out that a level funding for the Office of Homelessness Solutions, when rents are rising and when costs are rising and when homelessness is rising, is actually a cut. So would ask you to consider that and perhaps direct even more to a team that is actively working to ensure that our housing programs benefit everyone and that we can meaningfully address homelessness in our state. We know about the threats on the federal level. We have to make sure that we keep Maryland strong. And thank you for the opportunity to testify.
Thank you. And I just want to echo your comments about this DHCD leadership team being very focused on this issue. They work very collaboratively, and it's been wonderful to see that prioritization. So thank you for those comments. Do any members of the committee have questions for this panel? Delegate Acevedo.
Thank you, Madam Chair. And just a quick question. I know you all mentioned what the program does in terms of paying rent. Can you speak a little bit more to, because then there's the whole court proceedings, right? Folks who, cases may be filed. In a lot of these cases, I mean, the landlord has representation and the tenant don't. Can you speak a little bit more to that? Does this program deal with that, or this is just strictly rental payments?
I can speak to that, Delegate. Thanks for the question. So the state has made a significant investment in a right to counsel in evictions.
Correct.
And is on the way to getting toward full implementation. We're not there yet, but more tenants than ever are getting legal representation in rent court. I'm one of those attorneys, and we have a team doing the same. Eviction prevention funds are separate. It's actually money that gets paid to the landlord. And so this is me, an attorney for the tenants, coming to you saying, hey, we need to get money into the hands of small landlords to keep renters in their property. Because when we do our job best, we're putting up the best defense we possibly can. What if, sometimes folks just don't have the money. They've hit that job loss, they've hit those hours they can't work, and they are gonna face an eviction without some short-term financial assistance. It makes my job a lot easier because if I have a landlord who's not fixing the heat or fixing the leak in the ceiling, I can say to the landlord, look, we can get you paid, but you gotta make those repairs. And so the legal representation leverages the eviction prevention funds to really make sure we have safe, stable, habitable housing.
Thank you so much. Appreciate the answer. Further questions for this panel? Seeing none, thank you for being here. I see one more in-person witness signed up, Sarah Price with the Maryland Retailers. Great. So we'll welcome you to the table, and then after that, we will turn to our virtual witnesses, and we'll just let all of them in, and I'll call them as they appear on my list. So you may begin when you are ready. Welcome.
Thank you, Madam Chair. Good afternoon, honorable committee members. Sarah Price here on behalf of the Maryland Retailers Alliance and speaking specifically in support of the Main Street Maryland program. There are 34 officially designated Main Streets in Maryland, 9 Baltimore City Main Streets, and 9 affiliate Main Streets who haven't reached the full designation. And each of these communities receives funding directly from the neighborhood revitalization funds in the department's budget through a $1 million line item called the Main Street Improvement Program. These are basically critical funds that go directly to these main streets. They can use it for operating funds. They can use it to support their local businesses. They use it to support their staffing levels, to provide professional development and training, for beautification and cleanup efforts in the community, events expansion, DEI programming, historic facade improvements, and the examples go on. My written testimony actually includes statements from several of the main streets. But they do depend on this funding. Right now, the program is essentially maxed out. If the funding decreases at all, or if any new main streets enter the program, the allocations would have to be reduced. But continuing to fund these historic commercial epicenters will directly support the state's goals of growing Maryland's economy and easing the operational environment for small businesses. So we would urge you to please maintain that funding as was included. Thank you.
Thank you so much for your testimony. Questions for our panelists? Seeing none, thank you for your patience and waiting here with us today. So we'll now bring into our virtual room here all of the remaining virtual panelists, which I think we have 6. And so let's see, I see Holly Dekarsky, Mark Huffman, Amanda Rodriguez, Catherine Davis, Kaylee Shumitz, and Heather Sheridan are the ones on my list. So anyone, okay, great. And so I'm going to call you in the order that you appear on my list here. Each of you have 2 minutes to testify, and then we'll do questions for this virtual panel by subcommittee members. Remember that if you are streaming the YouTube channel, to please turn that off and listen and respond to the Zoom room instead. The audio doesn't have a delay. The YouTube channel does. Did you? Okay. So first on my list is Amanda Rodriguez from Turnaround Inc. Nope. There we go. You can come off of mute and begin when you're ready.
Thank you, Delegate. Madam Chair, members of the committee, my name is Amanda Rodriguez. I'm here to testify on behalf of Turnaround Inc. We're a victim service provider in the greater Baltimore region focused on supporting survivors of sexual violence, domestic violence, and human trafficking. We're urging for you to restore the full funding to eviction prevention and emergency rental assistance by reversing the 50% cut by DCHD. And essentially the way that this is used by Turnaround is to support survivors, mainly of intimate partner violence, that are fleeing imminent danger. In FY25, eviction prevention funding increased, or spending increased by the agency by 48% compared to previous years. We've also seen the reality of a 20% increase just at the beginning of this fiscal year in terms of need within our agency services. We serve hundreds of families, providing thousands of bed nights to our community's most vulnerable families fleeing violence. These numbers tell a clear story that more people need help, not less. Eviction prevention is not just a housing issue. Eviction destabilizes families, disrupts employment, and pulls children out of schools. It also imposes significant costs on our communities. We simply cannot afford to cut these critical funds. Instead, we ask for you to restore the funding levels to where they were last year to ensure that Maryland families have the support they need to stay in their homes. Thank you very much.
Thank you for your testimony. Next on my list is Catherine Davis with the Pro Bono Resource Center.
Thank you, Madam Chair and members of the subcommittee. I'm Catherine Davis, the Director of Pro Bono Resource Center Maryland's Courtroom Advocacy Project, which provides representation for tenants facing eviction. An overarching goal of this project is to promote housing stability among low-income tenants. And in recognition of that, a few hours ago, we added to our team of attorneys and paralegals an eviction prevention counselor who works with tenants after court to make sure they gain stability. Rental assistance is one of the best tools she has in her toolbox. And so I'm here today to applaud the inclusion of the $5 million in the community funds school program, but also to ask for the renewal of the $5 million in the less restricted eviction prevention funds. Leaving that out will leave thousands of tenants without the necessary support. We urge you to add it back in because it's a vital piece of this housing stability puzzle. Under the current budget, while many may be able to access funds if they have students in a community school, we have clients who are young adults, elderly, single, living in a neighborhood not served by a community school. Many of these clients want to stay in their home and they want to pay the rent that they owe. Most are working 1 or 2 or even 3 jobs, but are still having to make difficult choices about which bills to pay first. Very often we meet clients in court for failure to pay rent because they've had a temporary setback, a lost job, reduced hours, a divorce, or family crisis. This setback caused them to miss 1 or 2 months' rent, which resulted in a seemingly endless cycle of compounding late fees, court costs, and the threat of eviction. Often they're able to pay their rent going forward, but this threat of eviction is still looming. So eviction prevention funds can stop this cycle and avoid the unnecessary evictions. We know that every dollar the state spends on eviction will save $2.39 in the long run. With the payment of just a few months of back rent, many of our clients can achieve this housing stability that we're looking for. We're intimately aware of the thin line that separates housed families from those experiencing homelessness, and we urge you to replace the $5 million in the budget to keep families on the right side of that line. Thank you for your time today.
Thank you so much, Ms. Davis, for joining us today and for your testimony. Next on my list is Kaylee Shumitz from the Maryland Center on Economic Policy.
Thank you, Madam Chair and members of the subcommittee. My name is Callie Shumitz. I'm Vice President for External Relations with the Maryland Center on Economic Policy. I will be fairly brief. I know you all have had a long day, but I'm here along with the many other advocates in strong support of the DHCD budget and asking to please restore the funding at least to the current budget year's level for eviction prevention funds. As you've heard from other witnesses, it's really an important complement to this investments. We appreciate that the state is making investments in expanding the availability of housing. That's an important component, but preventing evictions and helping people stay where they are now is an important complement to that. And this would benefit thousands of Maryland families. So just ask if it's possible for that funding to be restored. Thank you.
Thank you so much, Ms. Shumitz, for your testimony and for joining us today. Next, I have Heather Sheridan from Baltimore County DHCD.
Good afternoon, Madam Chair and members of the committee. My name is Heather Sheridan, and I'm the Chief of Homeless Services with Baltimore County Department of Housing and Community Development. I'm here today in support of House Bill 350, containing the operating budget for Maryland DHCD. We understand that this is a challenging budget year, but we ask that current funding be maintained for Maryland DHCD's crucial Homeless Solutions Program, HSP funding. Baltimore County DHCD is recognized by HUD as the lead agency for our homelessness continuum of care for our jurisdiction. We convene and coordinate the funding for all of our homeless service providers. We are one of the 4 jurisdictions serving the most people experiencing homelessness in Maryland. Baltimore County DHCD awards just under $5 million annually in federal, state, and county funding to 13 different service providers, managing 25 distinct homeless services programs, serving at least 4,000 individuals in our county each year. Those programs include homeless prevention, homeless street outreach, shelter diversion, emergency shelter, short-term rental assistance, and permanent supportive housing. State HSP funding represents about a quarter of what we award to grantees and serves as a critical match and gap funding for what federal funding does not support, such as emergency shelter, street outreach, and homeless prevention services. Over the last 2 fiscal years, the HSP funding awarded to our county has allowed Baltimore County to provide services and housing placement assistance to 530 individuals living unsheltered in our county through homeless outreach. We've placed 91 households into permanent housing and provided those support services necessary to keep them housed. We've provided emergency sheltering for over 172 households with this HSP funding. We've prevented the homelessness and diverted 113 households from becoming homeless and entering our emergency shelter system. And finally, we've supported 122 households with short-term rental assistance, including 28 youth head of household families that would have become homeless otherwise. During the COVID pandemic, the federal government awarded Baltimore County with millions of dollars, $120 million in COVID relief funding to provide 8,500 evictions. However, over the
Excuse
last
me,
2 years,
Ms. Sheridan, I'm
yes,
so sorry,
no
but
problem.
would
I've
you mind
submitted
finishing your
testimony.
sentence and then we
Absolutely.
will, yes, go ahead, finish your sentence, please.
We just ask that these cuts are not made because cuts to homeless services increases cuts to other services such as hospitals and emergency services throughout our state. Thank you for your time and consideration.
Thank you so much for joining us today and for your patience. Now, Ms. Holly Dekarsky with the Easton Economic Development Corps. And thank you for your patience earlier when we had to boot you out of the room to bring you back now. So thank you. Go ahead when you're ready. 2 minutes, please.
Good afternoon, Madam Chair, members of the committee. I am Holly Dekarsky, Executive Director for the Easton Economic Development Corporation, and one of our many duties is the management of Easton's Main Street program, and I am here to advocate for funding in the DHC budget for the Main Street Improvement Program. This funding is critical to the survival of Maryland's 40-plus Main Street programs across the state. As nonprofits, we must fundraise a substantial proportion of our budgets, as well as advocate for funding support from our municipalities who are also facing budget cuts. We work with these tight and often difficult to forecast budgets so that we can carry out the mission of Main Street to promote and maintain a thriving downtown business core, the heart of our community. As the managers of Easton's Main Street, we promote and market our downtown businesses to the visitors and residents, host a mix of year-round community and economic events, provide beautification and pedestrian improvements, work to mitigate crime, safety issues and blight, fill vacant storefronts, increase housing, and recruit and retain businesses, all with our tight budgets, small staffs, and limited resources. We rely on the MIP funding to fill the gaps and use it in many ways. In Easton, we use our MIP funding for 2 key programs: promotion and marketing of our downtown district and its businesses, and for professional development. The majority is used to market downtown Easton as a destination for not only visitors, but for our residents as well, asking them to shop small and support local. This is critical this year as consumer spending on dining and retail have decreased since the fall as the cost of living has increased. As noted, we use MIP funding for professional development. We will be using a portion of our FY25 funding to help all 4 of our staff attend the National Main Street Conference this April, to obtain our needed education to execute the 4 points of Main Street, and to start to develop the next generation of Main Street professionals. I relocated here from a state that provides extensive training and certification to become a Main Street manager. Maryland doesn't offer that same level of training at this time, and it's necessary for me to send staff to the national conference, not only to maintain our designation with the state, but to get our staff the needed training, the Main Street principles, so that they can effectively market, grow, maintain, and assist our small businesses downtown. I would respectfully request that you protect the allocation in DHC's budget to ensure that the Maryland's small business epicenters continue to be funded. Thank you for your consideration.
Thank you so much for joining us today. Really appreciate your testimony. Last but certainly not least, Mark Huffman, Laurel Advocacy and Referral Services. 2 minutes when you're ready. Thank you.
Chair Shetty, Vice Chair Jones, thank you for this opportunity to share testimony. I'm Mark Huffman. I'm the Director of Client Services at Laurel Advocacy and Referral Services. We're a nonprofit providing emergency services, food pantry, homeless services in Laurel, Maryland. Also here representing Marylanders Against Poverty, which is a coalition of service providers, faith groups, and other organizations working to advocate for public policies and programs to help Marylanders living in or near poverty. On behalf of both groups, we urge you to add back the $5 million in eviction prevention funds to DHCD's Homelessness Solutions program to restore it to last year's level. Our nation and our state are in an interconnected homelessness and affordable housing crisis. Across the country, homelessness has reached record levels, and 3 out of 4 extremely low-income renter households are severely cost-burdened, which means they spend over 50% of their income on housing. When those families experience any disruption in income, they quickly face an eviction action and potential spiral into poverty and homelessness. As a result, most of the nearly 200,000 extremely low-income renter households in Maryland are one illness, one car problem, one sick child home from school that results in a lost paycheck away from eviction and homelessness. At Laurel Advocacy and Referral Services, LARS as we call it, we see this problem and progression firsthand. Since the official end of the pandemic in 2023, we've seen a dramatic increase in the number of people coming to us for assistance. At the same time, there's been an even more dramatic decrease in federal funds available to help, which obviously will probably be continuing for some time. So there's more need, but we have less staff, less resources to help them. It's no surprise from where we sit that evictions throughout the state of Maryland are rising back to pre-pandemic levels. Also, no coincidence that this winter, the Laurel Winter Shelter is at full capacity for the first time since the pandemic. So the best way to, and most economical way to reduce homelessness in our community and state is to prevent it in the first place. And so we urge you to, again, restore or add the $5 million in eviction prevention funds to the Homelessness Solutions Program. Thank you very much.
Thank you, Mr. Huffman, for your tremendous patience in being our last witness of the day. Do any members of the subcommittee have questions for this virtual panel? I see none. Thank you all for joining us. We really appreciate your testimony. We have your written testimony if it's been submitted, as well as the written testimony of many, many others. So thank you for your advocacy. And we have now concluded consideration of the Department of Housing and Community Development budget. That concludes our budget hearings for today. Stay tuned for tomorrow. Thank you.